I actually watched a good friend of mine that was not a life-term inmate who had a definite date to get out, turn green and die in his bunk.
Prison healthcare in the US is broken. After serving their time, prisoners will almost certainly be sicker upon their release, if they even make it that long. Joseph Calderon was in prison for 17 years.
While serving time in the security housing unit, I had chest pain one night, 7 sharp pains that woke me up out of a dead sleep.
Joe wasn't able to see a doctor the night of his chest pain. It wasn't until 2 weeks later that he finally got to see one. Joe says the doctor told him he just had a muscle cramp and sent him back to his cell with Benadryl. While prisoners are the only Americans who are constitutionally guaranteed to have healthcare, they often have to fight to see doctors and get medicine. Okay, so why is prisoner healthcare so bad? When it comes to political power, prisoners rank pretty much at the bottom. In certain states, they can't even vote. And prisoners rank at the bottom of the social ladder too. American society generally views people in prisons and jails as deserving of whatever mistreatment they get. There just isn't the political will to make prisons and jails more humane. And state and city governments are under tremendous pressure to make the cost of incarceration as low as possible. Low pay at facilities tends to attract less qualified doctors. Much of the medical care is outsourced to private contractors, who often rely heavily on unlicensed medical assistants instead of doctors. And it can take months to even see a doctor. One of those contractors, Southern Health Partners, only requires its doctors to spend 6 hours a week visiting jails. And one doctor may be responsible for thousands of inmates.
We see cases every day of the most horrific abuse and neglect of desperately sick people. A prisoner told to take Tums for what turned out to be cancer. Nurses failing to deliver medications and falsifying records to show that they did. We had one case where a nurse wrote in the patient's chart that he had, his vital signs were normal and he was in no apparent distress, despite the fact that the prisoner had actually died 10 hours earlier.
If they're lucky enough to get actual medical advice, prisoners might not be able to afford following it. They're still charged for copays and prescriptions. Their jobs in prison pay just pennies an hour.
The average pay scale is about 18 cents an hour, so $5 for your medications could start to add up.
Prisons and jails are designed to break people down. It's all but impossible to get meaningful care in a prison setting that is inherently detrimental to a person's physical and mental health. And stressful conditions, lack of exercise, and a diet full of salt, sugar, and carbohydrates don't do much to help sick inmates heal.
It's not unusual to see people who look 15, 20 years older than their chronological age.
So what do you think? It seems the real question isn't should prisoners get adequate health care, but how badly are we as a society willing to treat people in American prisons and jails?